Hi, my name is Stacy Madrid,
My name is Ryan Nostman.
And I am Irma Martin.
and we are doing our presentation on the PureWick female external catheter. Our group's topic is focused on minimizing the risk of CAUTI on female patients by utilizing the PureWick female external catheter. Our PICO question is, in female hospitalized patients, does the use of the PureWick or external female catheters compared to an indwelling urinary catheter decrease the incidence of urinary tract infections over a hospital stay? This topic is important to investigate because catheter-associated urinary tract infections, also known as CAUTIs, are the most frequently reported hospital-acquired infections. About 75% of UTIs are related to the use of catheters, and a patient's risk of developing a CAUTIs increases by 3 to 7% each day a catheter is in place. Limitations for the use of the PureWick is that not all patients are candidates for the device. The PureWick should not be used on the following patients: patients with loose stools, menstruating, those who are disoriented, unable to lay still for up to 3 hours due to the device can become dislodged, and need for strict eyes and nose.
The first article we referenced was titled External Collection Devices as an Alternative to the Indwelling Urinary Catheter, and this was a Level 7 study. The purpose of this research study was to provide an expert consensus of the use of EUCDs as an alternative to indwelling catheters based on review of current research into the matter. From this study, the authors made 4 key findings. CAUTIs are associated with MDROs in the long-term acute care setting, such as MDROs include Enterococcus faecalis, Pseudomonas aeruginosa, and other vancomycin-resistant bacteria. 2. Use of EUCDs resulted in lower bacteria rates of 70 per 1,000 patient days, while the use of indwelling catheters generated bacteria rates of 131 per 1,000 patient days. Lastly, an estimated 13,000 patient deaths per year are attributed to UTIs. Conclusions that were drawn from this study include 1. The use of EUCDs as a viable alternative to the use of indwelling catheters. 2. The presence of knowledge gaps in protocols for EUCD use. And 3. A need for additional research and development of nurse-driven CAUTI prevention bundles that incorporate the use of EUCDs. The second research article we referenced was a Level 5 study. It was titled Urinary Management with an External Female Collection Device. The purpose of this study was to qualitatively demonstrate how effective the use of an EUCD is at managing urinary incontinence in female patients through the review and analysis of 3 case studies. In this study, 2 key findings were identified. First, the prompt removal of an indwelling catheter may avoid a CAUTI. However, a secondary complication of urinary incontinence may develop. Second, that all of the participants in the study requested the use of an EUCD during subsequent hospitalizations. The conclusions drawn from the study include 1. An impression held by the authors of the study that scant research is currently available regarding management of female urinary incontinence with the use of an EUCD. 2. Female urinary incontinence is a challenge in the acute care setting. And 3. The use of EUCDs are a feasible and preferred alternative to indwelling catheters as reported by the participants of the study. The third research article we used was a Level 6 study titled A Non-Invasive Continence Management System, Development and Evaluation of a Novel Toileting Device for Women. The purpose of the study was to clinically evaluate the trial version of an EUCD with differing configurations of a female urinal interface. 5 key findings were identified in this study. 1. There was a mixed review held by the participants of the study regarding the fit of the different urinal interfaces. 62% reported no difference between the 2 interfaces, whereas 23% of the females reported that the smaller aperture was better, and 15% felt that the larger aperture was better. The second key finding was that 64% of participants rated the device as at least acceptable for daytime use. Third finding, 36% of the participants rated the device as very good for daytime use. Fourth, all the women who use the device at night, which was a total of 4, rated the device as at least acceptable for nighttime use. And 5, body positioning such as lying down, sitting, standing, or kneeling was found to affect the fit and thus the function of the device. From this study, the authors concluded that 1, there was a need for further development and research of the device. 2, this version of the non-invasive continence management system requires improvements in reliability, size, weight, noise level, and aesthetics. And 3, continued development in this area of the healthcare shows promise for the future of female EUCDs. The 4th article we referenced was a Level 2 study titled Medical ICU Reduction of CODI with PureWick. The purpose of this research study was to determine if the use of a CODI prevention bundle that incorporated EUCD use would reduce CODI occurrences in a medical ICU. The CODI bundle in this study was comprised of 3 components. 1, a review of the need for an indwelling catheter for each patient. 2, CODI prevention signage designed to educate staff about the risks of CODIs. And 3, utilization of an EUCD when appropriate. This study had 2 key findings. First, indwelling catheterization rates of 70.5% and CODI rates of 2.3% before the CODI bundle was implemented. After implementation of the bundle, the indwelling catheterization rates dropped to 64.1% and the CODI rate to 0.9%. The conclusion drawn from these figures was that the implementation of a CODI bundle that includes the use of EUCDs can reduce both indwelling catheter and CODI occurrence rates. The 5th article we referenced was a Level 2 study titled Identifying the Risk Factors for Catheter-Associated Urinary Tract Infections, a large cross-sectional study of 6 hospitals. The purpose of this study was to examine how the risk of getting a CODI changes over time, in addition to identifying risk factors that leave patients susceptible to acquiring a CODI. This study had 2 key findings. First, CODI rates were found to increase non-linearly for each additional day of catheterization. Second, paraplegia, cardiovascular disease, and female sex were found to statistically increase the chances of acquiring a CODI. The conclusions from this study were that 1, the risk of acquiring a CODI increases incrementally with each additional day of catheterization, and 2, special attention should be given to female patients and those with mobility issues.
Article 6 is a Level 4 study entitled Effectiveness and Functionality of the External Female Catheter Trial, with the purpose to evaluate and quantify the performance of the PureWick female external catheter in a simulated use setting, to assess the performance and user acceptability of the PureWick catheter. Key findings were that the device was found to be safe and effective in this healthy subject study. Conclusions stated that the catheter was able to capture urine and decrease the risk, being that it was less invasive. And this study was performed on healthy volunteers in a simulated lab setting and may not represent the acute care setting with actual patients. Additional studies may be warranted to fully assess performance in acute care patients. Specific hospital policies and applicable professional standards. There are no set hospital policies or protocols or procedures found in any institution in the near locale. During our search, we did find that Kaiser Downey Medical Center does mention the implementation of the use of the PureWick external female catheter for the prevention of CODIs in its use letter and educational rounding leaflets. In addition to that, Kaiser Downey has implemented their caution prevention bundle and toolkit, which includes to, and quote, consider alternatives to indwelling catheterization, including condom catheter, external female catheter, intermittent catheterization, adult absorption brief pads. As external female catheter alternatives haven't been in use for an extended period of time, and the compliance of the use is the main objective, there is no hard and fast set professional standard in place as of yet. Further data collection is needed to see if any professional standards have arisen from the use of the external female urinary catheters. Recommendations for clinical practice based on research and policy standards. After reviewing the literature, it is evident that a PureWick can be beneficial in a wide variety of female patient populations. The PureWick has been shown to effectively protect patients' skin from incontinent episodes as well as to reduce the number of Foley catheters used in the hospital. In order to truly promote the use of PureWick, a protocol should be developed and implementation on each hospital floor should be developed.
Next will be our video demonstration on the use of the female PureWick catheter.
The PureWick is an external urine collection device that uses gentle suction to draw voided urine away from the patient and contain it in a sealed suction canister. The PureWick can run on wall-mounted suction or a portable suction pump. The minimum recommended suction setting is 40 millimeters of mercury. The PureWick is designed to be used with female patients. To begin, obtain the PureWick, suction tubing, approved cleaning supplies, gloves, suction canister, and your source of suction. Inform the patient of the procedure you are about to perform. Begin by performing hand hygiene. And donning gloves. Attach the PureWick to the suction tubing. Then attach the suction tubing to the suction canister. Turn suction to 40 millimeters of mercury. Drape a towel or blanket to provide privacy. Assist the patient in spreading of the legs. Using the approved cleaning supplies, clean the labia from front to back. With labia separated, place the base of the PureWick against the gluteal folds and the body of the PureWick against the urethra. Allow the labia and legs to return to starting position to hold the PureWick in place. The top of the PureWick should be just above the level of the pubic bone. If urine is present, it should be drawn into the porous PureWick material, up the suction tubing, and into the urine collection canister for measurement and disposal at a later time. The PureWick should be changed every 8 to 12 hours or when soiled with blood or feces. To remove the PureWick, spread the legs and labia and remove the PureWick. When repositioning a patient, first remove the PureWick. Then reposition the patient and reapply the PureWick. Do not use barrier cream in the perianal area with the PureWick. The barrier cream will clog the porous material and render it ineffective. Do not use the PureWick with patients who have urinary retention, who are disoriented or agitated, or who are incontinent of stool.